Hello, my name is Sarah De Biase. I'm the Programme Manager for the Healthy Ageing Collaborative, which is a network of clinicians, academics, industry partners and lay representatives and other health and care professionals who've got a passion about improving care for older people who are at risk of frailty. The Healthy Ageing Collaborative is a programme of work funded by the Yorkshire and Humber Academic Health Science Network and delivered in partnership with the Yorkshire and Humber Academic Health Science Network Improvement Academy, which has been primarily about implementing the Electronic Frailty Index, a tool developed by the University of Leeds and other collaborative partners that enables us to use routine data within the primary care electronic health record to identify and severity grade those people who are at risk of frailty. So the Electronic Frailty Index tool is now available in 99% of GP practice electronic health record systems across the UK. So the tool itself provided us with the hook with which to engage primary care professionals and ask them to work with us to implement the tool and understand how best it could be used in practice. For example, GP practices are using the tool to target people at risk of moderate and severe frailty to offer them proactive assessment in their own homes by upskilled primary care nurses. CCGs are using the tool to develop targeted interventions for entire frailty cohorts, for example, falls prevention interventions for people with moderate frailty. And whole systems are using the tool to stratify their entire population in terms of frailty severity, mild, moderate and severe, and developing targeted care pathways for those different frailty severities using evidence-based guidelines. The Electronic Frailty Index has gained national recognition and the appetite for the tool has been significant. We've had 2 awards as a result of the Electronic Frailty Index, both an AHI Healthcare Product Innovation Award in 2016 and a RCP, so a Royal College of Physicians Patient Excellence Award in Innovation category in 2016. And the Electronic Frailty Index and the Healthy Ageing Collaborative were used as a case exemplar in the Yorkshire and Humber Academic Health Science Network application 3-star reference site status in the European Innovation Partnership Active and Healthy Ageing programme. As of July 2017, the Electronic Frailty Index has been recommended as one of the tools that GPs can use across primary care in England to identify people at risk of moderate and severe frailty as part of a new NHS GP frailty contract. The most outstanding achievement for the partners involved in the Electronic Frailty Index implementation, including academics, industry partners and the Academic Health Science Network and the Improvement Academy, as well as primary care clinicians, has been us being able to take a tool which has been validated in clinical research, implemented into routine practice, and then have it go on to be recommended in an NHS England GP contract within a 3-year time period. Going forward, we hope that the recommendation in the NHS England GP contract will enable further spread and adoption of the tool in practice. We've already engaged actively with 152 organisations across the UK, 82 of which are clinical commissioning groups within England. And the hope is that this would spread significantly by nature of the NHS England GP contract. Ongoing partnership between the Academic Health Science Network and Yorkshire and Humber and the Improvement Academy includes supporting primary care across the region to implement the requirements of the NHS England GP contract, and hopefully we will be able to support further case studies being generated that show how older people at risk of severe frailty can be offered new evidence-based, individually targeted interventions that enable them to live well for longer in their own homes and reduce their reliance on health and social care resource over time.